We'll get to talk about the two types of conceptions that we have. This is what is known as the assisted conceptions and the natural conception. So they are very, very simple terminologies, all right, but they might sometimes seem to kind of like confuse us time to time, you know. So assisted conceptions, natural conception. So for this assisted conception, you could actually see it. This is what IVF is, the word in vitro fertilization, that's assisted conception. Then we have the natural conception, which is in vivo, you know. So we'll just quickly talk about it. Of course, we'll start with the natural conception because it's the easiest and it's the one that we all know. So natural conception is just a process by which pregnancy occurs without medical intervention. Like two people had sex and the whole thing was just natural. It just went down the line like that. So there's ovulation, there's fertilization, there's implantation. Do you understand? That's all the stages. So factors that support natural conception is if the woman is having a normal menstruation cycle, all right, and there's no disruption in it, you are sure that if the husband and wife track the menstruation cycle towards the ovulation time and they have sex that time, no issues will come up. If the man's sperm is, the sperm count is normal and the shape of the sperm is normal, the way the sperm is moving is normal, you understand? So the fallopian tubes are also open. Of course, we have disease conditions that the fallopian tubes are kind of like closed up. If the uterine anatomy is normal, all right, timed intercourse during the fertility, the fertile window, okay. Then for assisted reproduction, we're now trying to say a two couple cannot actually go on with the natural reproduction. They have to actually, you know, require some kind of like medical assistance, okay. So examples include ovulation induction. So probably the woman can make eggs or can't make eggs at that time when you need it, so you induce it. Intrauterine insemination, probably this could be that the sperm is having issues moving. That's the motility, okay. So you can now just help the sperm and take it much more closer to the egg, okay. Then in vitro fertilization, this one you take the egg, you take the sperm outside the body, you fertilize it. Now please, you can actually on this side read reasons why we might want to do any of the interventions, okay. The intracytoplasmic sperm injection, this one you are taking a sperm, you are helping it to the extent of just putting it directly into the egg. Then donor eggs and sperms, okay. This one, probably the husband has issues with sperm, so you get sperm from another man. It could be that the wife's eggs have issues, so you get eggs from another person. Now this could be done on business basis, or this could be done like you still know the person, all right. Then surrogacy, this is when, you know, an egg is taken from the husband, all right. Egg is taken from the wife, sperm is taken from the husband, you fertilize it outside, then you implant it into another woman to help your wife carry, you know, the pregnancies. So you might be asking why, and on this side we have the reasons why you might actually want to do any of the, you know, assisted conception methods. So comparing the two, cost, the natural one is natural, it's God-given, is costless, right? The assisted one you have to pay, all right. Emotional impact is less stressful. The assisted one, there's a whole lot of, you know, hormonal stuffs, right? Success rate depends on the age and health. This one depends by the method and individual factors. The medical involvement is minimal on this side. This one, there's high medical involvement, there's frequent monitoring and all have you. So when is it recommended? So after 12 months of trying to get pregnant without success, all right, if there are some known fertility issues, same-sex couples, you know, all those LGBTQs, right, the genetic concerns, if natural, you know, conception will lead to some kind of giving birth to some embryos that are suffering from one or two disease conditions, you might want to do the assisted ones just to make sure that everything is going all right. Okay, so that's it.